Director of the National Association for Workplace Healthcare. I want to thank you for joining us in our first Monday roundtable. This month, the topic is driving engagement and maximizing health center utilization and ROI. And we're pleased to have speakers from Howden USA participate. You change the slide, please. So for those who are not familiar with us, NAWHC, formerly the National Association of Worksite Health Centers, we're a nonprofit membership organization for employers and others who have on-site, near-site, mobile, and virtual health centers, as well as do direct contracting for a variety of services. We also have vendor partners, health providers, clinic vendors, pharma consultants, a variety of groups. Anyone who's interested in this type of healthcare benefit is welcome to join. We offer educational programs like today's, networking, benchmarking, research, and a variety of information all about this area. So if you want to learn more, please go to nawhc.org and contact me. We'd be glad to share that with you. Next slide, please. These are a couple of the other programs we have coming this month. A session on occupational health services at the Worksite Center on June 11th. And then we co-host the on-site clinic employee wellness conference in Chicago, June 25th and 26th. So if you're interested in any of those programs, please go to the website or you can contact me directly. Next slide. So in our program, the roundtables that we do the first Monday of each month, a little bit different than our webinars. So what we'd like to do is I'm going to go around the table for everyone who's on the call, ask you just to give me your name, title, organization, a little bit about what you do, but just for about 30 seconds, so everybody knows who's on the call. We'll then have a presentation by our content experts and speakers. And then following that, again, I'm going to go around the table and ask anybody if you want to share any experiences, if you have questions or information, whatever you'd like to do, or suggestions about how the best the topic is. Also, we're going to record this session, and it'll be made available to everyone on the call, as well as posted on our website and our newsletter. So with that, let's change the slide, and let me go around the table. And as I call out your name, and again, I'll just do it based upon how you show up on my screen. Again, just give your name and organization and what you're doing. So let's start out with Christy Patterson. Christy?
Good morning, Christy Patterson. We operate a multi-employer pool and have two near-site health and wellness centers for employees of school districts here in Butte County in Northern California.
Great. And your role there, Christy?
I'm the executive director.
Great. Thank you very much. Julie Gilliam. Julie, can you introduce yourself, please?
I'm Julie, and I work for Optimal Health Initiatives. We have a consortium of schools and public libraries and ESCs. And within that, we have on-site clinics. And I'm the Senior Director of Operations.
Great, thank you. Alicia Engel, Alicia, I'm sorry.
Good morning, everyone. My name is Alicia Engel. I'm apparently, here we go. Let me see what I can do here. Ta-da. So good morning. I'm from Peoria, Arizona, the city of Peoria, Arizona. I'm the new wellness program administrator. I've been with the city for about 2.5 years. Bring a broad professional background from a lot of different business contexts, but especially some early career experience working for a Fortune 500 health insurance company. So very excited to be in my current role and helping the city of Peoria open its first dedicated employee wellness clinic.
Great. Thank you, Alicia. By the way, I live in Peoria as well. Be glad to come down and visit you at some time. Excellent. I sent a note to Christine Nickel, by the way.
Yes,
so say hello for me.
I will. Thank you.
Thank you. Brittany Groves. Brittany, please introduce yourself.
Hello, I am Brittany Groves. I'm the HR manager over the benefits and leave departments for Toyotetsu North America. And we make tier 1 auto parts in 5 different locations across the U.S. and 1 in Canada, 1 in Mexico. And we have a couple on-site clinics. So I'm excited to hear today's presentation.
Great. Thank you for joining us. Deanna Hall. Deanna, introduce yourself, please.
Yeah, hi, Deanna Hahn. I am a director with SSM Health at Work and our Direct to Employer Services. So we operate on-site, near-site clinics.
Great. Thank you. Eddie Chen. Eddie, introduce yourself, please.
Hi there. My name is Eddie Chen. I'm Director of Product at Handpicked Health, and we combine APCs, and care navigation to help users along their healthcare journey.
Great, thank you. Jean Cook, Jean, introduce yourself, please.
Hi, good morning. This is Jean Cook. I am officially starting with Healthcare Solution Centers starting next week. So I'm brand new, but I believe Rebecca is on the call. She can tell you more about what we do.
Thank you. Jen Maas, Jen Mays, excuse me. Introduce yourself.
Hi, good afternoon. Jenn Mays with Novant Health. We're a health system in the Southeast, and I work with the direct-to-employer division responsible for commercial product and growth.
Thank you. Nicole Hensel, please. Nicole, introduce yourself.
Hi, this is Nicole Hensel. I am a Director of Primary Care Services with Texas Health Physicians Group, and we just recently acquired a partnership, direct to employer with Cook Children's.
Great, thank you very much. Becca Ducar, Becca, introduce yourself, please.
Hi there, Larry. My name's Becky, and I'm pretty close to Larry. I'm in Phoenix, Arizona, kind of all around there. I work for Healthcare Solutions, and I do the operations there. So we'll have to reach out to Peoria.
Thank you very much, Becca. Rashni Patel, Rashni, please introduce yourself, please. Rash, go ahead. Yeah, we can barely hear you, dear. Okay. Great, thank you very much. Tracy O'Neill, Tracy, introduce yourself, please.
Good morning, I'm Tracy O'Neill Hooker. I'm the medical director for Theta Care at Work, our on-site clinics. We have many on-site clinics that are dedicated to different fields, you know, the school systems and manufacturing, but we also have a couple shared clinics that offer care to patients for multiple different clinics. So a big mix of things.
Great, thank you very much. And lastly, Trisha Nakano. Trish, introduce yourself.
Hi, yes, thank you. Trisha Nicanao, Health and Wellness Manager for Sheets. So I work on the benefits team and also work within our 3 on-site healthcare clinics, soon to be 4th.
Great, thank you all very much. Now, next slide, please. I'd like to turn it over now to our content experts and our speakers for today, Megan Taskey and Jen Smith. So turn it over to you guys.
Thanks, Larry. We can go ahead and go to the next slide. Before we do our introductions for Megan and myself, just a quick introduction of who Howden is. We are a broker here in the U.S., just like, you know, many other brokers I'm sure you all have worked with. We are not new by any stretch of the imagination. We are actually UK based and have some newer US presence, but we are a top 10 broker. For those of you, I know I heard you had maybe some locations that weren't in the US. That's where we do a really great job also. So feel free to ask questions surrounding maybe strategies in those markets as well. Go ahead, next slide. So as part of, you know, Howden's growth here in the U.S., what we found very interesting is they actually recruited, you know, a team of 5 of us. Our team, which is known as the Clinic Consulting Group inside of Howden, we 100% focus on helping employers with their on-site, near-site clinic strategies, as well as direct contracting strategies. It's why we align with NAWOC so well. I actually happen to be a recovering employee benefits consultant in general. I actually reside in the state of Wisconsin. If you know anything about the state of Wisconsin, we're the third most expensive state for healthcare in the union. So if you're an employee benefits consultant in this market, you need to get very strategic regarding things like on-site, near-site clinics and direct contracts. My career took me to a point 3 years ago where I got a chance to 100% you know, help employers with these particular strategies. And that includes anything from advanced primary care, again, direct contracts and occupational medicine strategies. On the phone or on the webinar with me also is Megan Teske. She's been a consultant who has worked with me alongside me for about 3-4 years. And she'll introduce herself when she starts to talk in a minute. Next one. So purposes of today, we're talking about increasing utilization, which actually maximizes ROI. I wanted to take a minute and take a look at this equation here in general. If you're an employer on the phone or even a vendor in general, we talk about healthcare value a lot. And one of the reasons you offer an on-site health center is to increase the value of healthcare probably inside your organization, as well as probably in your market. When we talk about value, sometimes our mind always just goes 100% to cost, right? And so we just want the least expensive version of whatever it is in order to either mitigate costs because the market's expensive or even offering the solution. One of the things I want you to think about today as we talk about maximizing ROI and maximizing health center utilization is actually the numerator here. It's quality outcomes and patient experience are really what's going to drive member engagement inside your on-site health center. Next slide. Part of this is, I kind of mentioned I'm a recovering employee benefits consultant, is think about if you are touching benefits inside of your organization, are you doing strategic planning? Most often people say, yes, we are. We might do it quarterly, we might do it semi-annually, we might do it annually, but we know where we want our benefits to go. Sometimes, unfortunately, we set it and forget it as it relates to on-site health center strategy. It's like, okay, we got funding for our on-site health center. We're going to open our on-site health center, or it's been open for years and it just kind of sits there. You don't really know what you want it to do. It's really, really important as you think about increasing health center utilization and member engagement to really have SMART goals. Make sure that they're specific, right? That you actually know what they want, what you want that goal to do. They're measurable, they're attainable, they're results oriented, which is actually, that's a Jenn Smith special right there on the R, and then timeline based. You can see an example of one of those on the right-hand side. You might want to say you want to increase utilization, but how are you going to do it? Right? What is the number you're shooting for? And then did you meet that goal? And you should be doing this year over year. I definitely suggest you start with at least 3 to start to say, how do you want to increase that utilization? Next slide, Meg. So part of this is this slide, what this slide is going to tell you, we're not going to go through every single one of these just based on time today. We're going to take a look at type and we're going to take a look at return on investment. Sometimes we're working with employers or we get retained to work with employers in order to increase that health center utilization, or there might be some discontent with the current on-site health center. My first question to any employer who might be going through that or who wants a health center is, what do you want the health center to do? And if you can't answer that question or you haven't gone through an exercise to really understand the services that you want inside the health center, how you want the health plan to be running alongside of it or near it, or what you want that return on investment to look like, you need to reset because there will be some discontent at one point in time. If we look at the first one, I want to talk about type. Super important to understand what you're offering inside the health center and making sure that you have the right vendor partner associated with the services you want to offer. Acute care, preventive care. Okay, acute care, sinus infections, rashes, etc. There might be some value there as far as convenience is concerned, but really where the rubber hits the road from a maximizing ROI perspective is when you're offering advanced primary care, meaning that you're treating about 80% of care at the primary care level, not just those rashes and sinus infections, because I'm here to tell you that those are not what is driving your long-term health plan costs in general. One extra thing I want you to think about here today is occupational medicine and workers' compensation. I'll have Megan, you go to the next slide here. If you are in manufacturing, I would highly suggest you take a look at a combination clinic, meaning that you're offering both advanced primary care and occupational health at the same time. A long time ago in a place far, far away, we thought, nope, can't do it. You don't want to combine the two. We've got safety in a silo over here. We've got benefits in a silo over here, and we shouldn't talk, okay? That I would definitely say, as we take a look at trends in the on-site health center world, the combination of an occupational health center alongside primary care is so impactful to what we would call worker well-being or to the end user, to that member. We have so many stories of employers who have combined these particular strategies that actually show that, okay, you've got a big burly welder coming in for his pre-placement physical, right? He knows that there's a doctor, a nurse practitioner, or PT, or physician's assistant there. The next time he's not feeling well, he probably goes to the center. And it happens over and over and over again because, okay, I think I might have a bladder infection. Nope, you've got sugar in your urine. It's diabetes. Now we need to start treating you as a patient rather than walking into the emergency room, to the urgent care, or just avoiding care altogether. It becomes a very nice tie-in. And we do see our health centers that also offer occupational health and primary care. We've got increased utilization in the first 1 to 2 years significantly in municipalities as well as manufacturing. Next slide, Megan. The last thing I want you to think about is return on investment as we finish up this section of the presentation. The reason I want you to think about return on investment is it's very important for your organization as a whole to define what's impactful return on investment for you. The reason I highly suggest that is because utilization does drive return on investment, meaning the more that the clinic can absorb that would have taken place in the market or out in the wild, the higher your ROI will be. The other piece you want to think about too is your budget, meaning the cost of that health center, the cost of the staff in that health center is all driven by the kind of health center that you want, right? And will also impact your ROI, right? So if you're like, I need to have a doctor on site, that's going to be a more expensive health center, right? So you're going to have to make sure that you are accounting for the services that are going to add to that return on investment. Another really good measure here for you to understand and some goal setting that can actually happen around some of these metrics is, are the clinic users or the folks who are using the clinic for primary care, do they cost the health plan less or more than those who don't? Right? And you should be able to carve those out into different disease states, meaning that let's take a look at folks who are using it for hypertension. Are they costing the health center less? Right? Take a look at your referrals, right? Are you getting 80% of care being held at the primary care level, right? The more services you can offer inside that health center, the more engagement and utilization you'll get, which in turn will maximize the return on investment. Next slide, Megan. And I'm going to let Megan go ahead and jump in here.
Awesome. Thanks, Jen. Yeah, so to just build on the point of ROI and considering the return on investment and the value that your clinic is bringing to you, you know, there's certainly other metrics outside of just that financial lens of it to consider and make sure that you're looking at when you're building a clinic or if you're well into your clinic strategy. So just to touch on a few of these, I think what's critically important is that with your vendor partner, you're strategizing on about the specific metrics that matter to your organization on the front end, right? So does it matter how many folks are attributed to your health center? Do we want to break out by employee segment? Maybe we have different pockets of our population. That really helps us understand where are the gaps and where are the opportunities. If we notice the administrative folks are utilizing the center more than those who are on the plan, how are we crafting our strategy, our communications, our efforts to really help draw that portion of the population in? Maybe we even find that it's, you know, dependents that there's an opportunity there. So do we look at and consider offering, you know, annual physicals during the sports season and just think of creative solutions on really how we can adapt our strategy and drive other pockets of the population in? When we think about other metrics, is it the member experience that matters too? Is it that NPS score that, you know, it's sometimes referred to as kind of the warm and fuzzies, but was that the intent of why your clinic was placed in the first place? So is that something we want to continuously measure over time? Also, reduction in healthcare and workers' compensation spend, right? So to Jen's point of how are we analyzing the cost for clinic users versus non-clinic users, how is that impacting our overall healthcare spend, and are we seeing a trend down as that clinic is implemented? It's really critically important too, if you have occupational health as a component of your health center, that you are involving all stakeholders that are touching workers' compensation within your organization. So that includes the safety managers, that includes you know, anybody involved in that decision process, so they can really speak into, here's what matters to us, because you sitting in that benefit space might not have all the inside knowledge and expertise. So how are you bringing all of the folks to the table when you're really truly identifying what metrics need to be measured and what matter? When we think about clinical outcomes and population health impact, Are we looking at how are clinic users adhering to their age and gender screenings, their mammograms, their colonoscopies, right? So these are all factors that can really be influenced by your on-site health center and really help drive substantial outcomes collectively for the overall health of your population. We also think about operational efficiency and performance guarantees. So working with one of our clients in particular, I'll just share a little bit of somewhat of a case study here is in relation to their performance guarantees. This is a very mature clinic in the manufacturing space, really having tremendous success in their healthcare, in their on-site clinic overall. Over time, those performance guarantees really sat stagnant. So it was kind of a rinse and repeat year after year of here's what the vendor was, offering as compensation if they weren't met. Well, we identified based on, reviewing annual reporting, reviewing kind of, again, the SMART goals of the client. Those really didn't matter anymore. The clinic already superseded those metrics. We needed to look at something different. So we really took a deep dive and thought about where are the gaps that are existing. We found that there was some opportunity with the age and gender screening. We found there was some opportunity with how workers' compensation was being managed. So we really worked and pushed on the vendor to think about the performance guarantees that actually matter to this client versus just ones that were set in place for years to come. And we've now, they've been willing to adjust those performance guarantees again to reflect what really mattered to that client in particular. So I just highly encourage as you're working through and setting your strategy in conjunction with the ROI, obviously the financial impact is, a main component of your clinic, but think about everything else outside of that also has an impact on what's happening within your clinic and how it's affecting your population. When we talk about a best practice strategy, we really focus on benefit integration. So we really highlight the health center as truly being the center of your benefits ecosystem. So one thing that's critically important to do, maybe you have a brand new clinic or maybe you have a very mature clinic. I think if you take a look and step back annually and really focus on how are we aligning our entire benefits ecosystem with our health center? Does our health center know about all the great benefits that we have to offer? If our health center doesn't know, is it likely that our employees who are visiting the health center know? And how are they directing care accordingly? So one thing we like to do, and it is extremely valuable, is hosting vendor summits. So bring all of your vendors into the room along with your health center and have a full day where you're really going over what's kind of new happening within that specific benefit or that specific vendor. How can the health center really be a champion of that benefit that's being offered and refer members as needed and as necessary? That's really where we find a cohesive strategy because oftentimes members forget, right? They don't necessarily remember what all great benefits you have to offer. And if you're just talking about it during open enrollment once a year, it's not going to be top of mind. So how are we partnering together and how is a health center really leading that charge and directing members to the appropriate places of care as they need it? Another important strategy is around communication. So when you think about communication, I think a lot of these bullet points here are no-brainers, right? There are probably a lot of things that majority of you are already doing within your health center. But what I want you to think about is it appropriate for your population, right? So if you have a population who's plant workers on the floor all day long, doesn't have their smartphone, doesn't have access to emails, are the email strings really going to be impactful to them? Most likely not. So how are we thinking about adapting our strategy in relation to communications to something that will resonate with your population? Maybe that's where the, break room communications go into play. If they're eating their lunch in that same break room every day, again, but not on the computer, how are we having materials and resources available for them within the break room? One thing I do want to call out that was unique that we implemented with a client as well is to the right here, the graphic you can see on the slide. So we coined the name of companion card. You can, call it what you please. That just is what resonated with this client in particular. But again, they had a lot of folks who were in that exact position, who were out on the floor, not having readily available access, to the information. And this card was created, as you can see, front and back, to really just highlight a quick overview of key services, including their on-site clinic and other information that they may need to know. So that way, if something does come up in the middle of the workday after they're leaving their shift, they can easily dial into the number, scan the QR code, get an appointment set up without having to search or having to contact HR or trying to figure out where to go, or because they don't know where to go, just running to the emergency room. So it's just about thinking about your population, what would resonate, and how can you think outside of the box versus all the traditional lines of communication strategies that we've seen work in the past. Another key thing, which I feel like goes without saying, but is just an important thing to consider and think about, is that are the materials translated in the languages spoken across your workforce? We had one client in particular who had about 46 languages that existed amongst their population. Now, no, we did not translate every single material into all of those languages, but we really understood what are the top 3 to 5 languages, and how do we even have taglines on all of the materials so that it resonates with folks of different backgrounds, different ethnicities. The other thing too is how healthcare is translated into their language may not be the exact translation into English. So again, is it a symbol, right? Is it a Red Cross symbol? And that's what you really deem as, a cohesive symbol that exists across all your populations that's recognizable as meaning healthcare, health support. So again, I just think it's really important that you're thinking about all of those kind of little factors as you're designing your communication and engagement strategies. Next to it's very important that your health center is truly the easiest front door to care. So as I talked about earlier, and making sure, again, it was the center of your benefits ecosystem. Also, depending upon the location of your clinic is really going to drive your engagement. So knowing that your clinic might already exist, and you're not going to pick it up and move it at this point, but within that location, how are you also making sure that you're aligning the clinic hours to reflect what are different shift schedules within your organization? If you're a standard 8 to 5, making sure that you have some early morning hours, making sure you have some hours going into the evening. If you have, workers who are on second and third shift, how are you aligning and adapting that? And if it's not possible to align your clinic hours directly to meet everybody's needs, what's available from a virtual perspective? Again, how can you really ensure that you're reaching the masses of your population and making it the most convenient so they know that's the immediate place that they go to? Also, as far as scheduling purposes go, thinking about, does the vendor partner you're working with have an app? How are we then embedding QR codes on our communication materials, on the companion cards, as I mentioned in the previous slide, to really make sure, again, we're making it extremely easy for members to schedule an appointment at the time that they need one. I also want to talk a little bit about staffing capacity. So if you look at the lower left graph, the visits by hour by day, this is an example of a client we're working with who was really seeing some challenges in having availability for same day and next day walk-ins. So think about, as Jen alluded to, some of those who may have acute care needs, who would most likely run to the emergency room. If your child wakes up, you think they have a fever, sinus infection, something's going on, you want to be seen that day to get their treatment path started. Well, you're calling your clinic, nothing's available. What next? Your odds are you're going to run to the emergency room because you want to help your child out so that they can feel better. So in this example, the client in particular, again, like I mentioned, was continuing to see struggles with availability. So what we decided to do is get a full scope analysis of, okay, what do the visits look like? Let's get a full breakdown, not just on a monthly basis, but let's look at the whole year and really figure out, where do we see some lower utilization and how can we block that for same day, next day availability? So we blocked an hour over the lunch period where appointments could not be scheduled, just they remained open for those walk-ins. We advertised that amongst the population and saw tremendous success in folks actually being able to get within that same day or within the next day. Then a little bit more about staffing capacity. So the chart here on the right, I get that it's a little bit of an eyesore, but I'll walk through it and give some intel on the purpose and creation of this. So another client who was a city client had tremendous engagement overall. They were running their wellness program through their clinic, facilitating annual physicals on site, and they were running into issues where availability was a problem. They wanted to add more staff on, but obviously, as I'm sure you've all experienced, budgets are tight and you always need justification for what you're doing and why you're doing it. So they were at a crossroads of, we know we need more staff, but we don't feel like we can afford it. What next? So this is where we came into play and did a feasibility study of, if you brought on another provider, what would you need from a visit perspective in order to hit a break even from a budgetary and ROI stance? So we really, again, crafted this out for them to realize that it really wouldn't take, you could fill, you could break even by just filling capacity at 23% of the time with another provider on board. We got this in front of the CFO and he's like, great, this makes sense. I'm on board. Let's do it. So it literally took all but a half hour to have the conversation and frame this up for them to really understand we're not going to continue to improve our ROI unless we add more staff. So we do need to pay those costs up front, but here's what we'll see as the return in the long run. So again, I think it's really important that you have a good pulse and a good handle on what's happening within your clinic and when are there opportunities and times to really enhance and provide additional ROI? And are we finding ourselves stuck in a place where we just can't justify spend? We just can't justify shifting the schedule around. But these are little areas and little opportunities to really just dig into and identify how you can improve the overall satisfaction and availability within your clinic. Aligning financial incentives with desired behavior is also critically important too. If you want folks to utilize your health center, you built it for a reason. Again, you don't want them running off to the ER, to urgent care, unless it's absolutely necessary. So how are you communicating that to your folks? The chart here on the left, I think, is just a really simple snapshot that can easily be sent out as a part of your communication strategy to really just showcase the value of an on-site clinic. Oftentimes, right, there's typically no cost for your health center visits. Of course, if you have an HSA plan, you certainly need to think about fair market value and how are you instituting, a copay that's reasonable for folks and isn't really deterring them away from the clinic, but again, to ensure that you're in compliance. But again, when you look at this chart and think, okay, little to no cost to utilize the on-site clinic versus what will be the out-of-pocket cost for the employee if they were to visit, another healthcare option out in the wild. And I think, again, it may seem so simple, but people don't know what they don't know. So how are you ensuring that you're communicating this information, really making it available and making it known to them? What is the most cost-effective option for me and my family, and that in turn will help drive utilization and engagement at the health center. Another thing to think about too is if you're offering labs, medications, or any type of specialty referrals that are tied directly to the clinic. What are you offering those for? Is it no copay? Is it a reduced cost? Is it a direct contract that you're setting up for physical therapy services, for example, that just really make it a seamless integration and a seamless referral for the employee? So again, they're not spending their own time trying to research options and opportunities outside of that clinic. So again, using that clinic as the hub and really ensuring that you're keeping costs low and aligning, what you have designed from a financial perspective with what outcomes you're trying to deliver. Another great tool to just embed within is your wellness program, right? So if you have integration with your wellness program and your on-site clinic, facilitating and offering biometrics through a partnership, that immediately, it's again a very simple process. We're getting a blood draw, and then our providers are seeing the results in real time and have the ability to say, hey, I noticed, your blood pressure looks high. Let's get you into the clinic for a visit so we can further evaluate. So again, it's really thinking about these maybe small, unique tools to just get them within the clinic walls and really then drive that engagement from there. Lastly, I want to share an amazing case study that actually we just are publishing now, but this group in particular, so it's a self-funded municipality and they have 1,400 enrolled lives. And they came to our team and said, hey, we're really looking to lower our medical spend, and our folks are having issues with accessing care out in the community. There's long wait times. They need referrals. It's far from their home. What should we do? So this is where we really sat down with them and started off, as Jen alluded to earlier, with a goal setting session and said, what are you looking for? What are you trying to accomplish? Is a clinic going to be a right fit for you? And after running them through a goal setting and strategy session, we put together a feasibility analysis to really identify, what would the cost look like up front? How would that impact your healthcare spend? And when could you anticipate realizing a positive ROI? After seeing the feasibility study, going through the SMART goal strategy session, they realized this was the right direction and right move for them as an organization. So then we conducted what we call a reverse RFP and went out to vendors, again, that really fit their population. And we were really strategic on how we did that. We didn't just say, there's 6 vendors out here, send us your spreadsheets, send us all your information. But we really ensured that it aligned with exactly what the city was looking for. We then, once the vendor was decided, we helped with contract negotiation. So read through all those little fine terms and lines and, pulled apart anything that we felt wasn't conducive to them overall. And then we stood side by side with them and helped lead the implementation. So providing oversight and expertise along the way of really identifying, again, some of the things we talked about through today's presentation of what we really wanted the clinic to do, what we wanted to measure along the way, to ensure that the vendor knew about everything on the front end so that reporting could be aligned, so that the performance guarantees could be aligned, and that we weren't having to backpedal a year into the relationship of, wait, we're missing this, we need this, can you add this? So within 9 months of the health center opening, they saw 61% overall member participation. A further breakdown of that, 96% of employees, 39% of spouses, and 33% of dependents were engaged at the health center. These are absolutely phenomenal results. I'm sure some of you on the phone, probably have your numbers that you're looking at and thinking about right now as well. But within 1 year's time frame, to see these results for a clinic is astounding. Typically, we're happy to see 30% overall engagement in general within a health center within 1 year, just because naturally it takes time for people to understand the benefit, the value, what services are being offered. So this is just an incredible performance overall. On the right, you'll see a chart here really showing the client results on the left-hand side compared to the vendor's book of business. So as you can see, every single result that the client has achieved in these 9 months is superseding what the vendor is seeing on average across their book of business. So, one other one that I want to call out too is the specialty referral rate. So if we look down, the client is experiencing 10.6% specialty referral rate compared to the 16% in book of business. And what that's really showcasing is that the clinicians are operating at the top of their license. So they're not just unnecessarily sending things outside of the clinic. They're handling the diabetics. They're handling the hypertensive. They're handling, health coaching, whatever that may need, versus driving them outside of the health center, creating a breakdown in care, driving up your healthcare spend. So this is, major credit to the city and the vendor partner as well of really identifying what can be done within the four walls of the health center. One other call out that I want to make as well is the bottom kind of goldish box there. So this client in particular, too, obviously being a municipality, has a lot of workers who are outside on a daily basis, right? They're in the sun, they're shoveling dirt, they're mowing lawn, they're doing all of those outdoor activities, and they really identified, again, what are services that can be offered within this clinic where we can really ensure that we're meeting our population's needs and helping from an early detection standpoint. So skin screenings were one offering that could easily be conducted. So within this time frame, they had 105 individuals who completed a skin screening. Of those 105, there were actually 26 suspicious lesions that ended up being removed, including 2 early stage melanoma detections. And I tell you that because that is extremely impactful. We know that anytime you're detecting cancer early, there's obviously going to be significantly reduced downstream treatment costs. So advanced stage melanoma can actually be 25 times more expensive to treat than an early stage diagnosis. So just these 2 cases alone in itself provides so much value for what the onsite clinic is doing. And again, how do you measure the cost of a cancer that didn't exist? Really hard to do. But again, these are the stories, these are the numbers that make an impact and make a difference, and why you have your clinic and what you're doing. So to kind of wrap up this case study, I think, one of the biggest things to take away too is looking at this from a partnership perspective. So this was a 3-way partnership between our team at Howden, between this engagement from the city, and between the vendor partner. So all 3 of us being at the table, strategizing, working together, and really understanding what are the overall goals of this health center and how are we all going to come together and work as a cohesive unit to make sure that they're being realized. So again, I think it's just really valuable and important that you're knowing, the capabilities of your vendor partner. Who are you working with from a consulting lens? Who's helping support this? And maybe seeing things from a different lens that might not be top of mind that you can really focus on, again, to enhance your overall offering.
So last slide here. I mean, interestingly enough, it was kind of funny. I mean, anytime, if you've ever worked with Larry, he's always talking, anytime you've done a presentation for NAWAC, there's a lot of prep that goes into it. And we kind of always ask, like, Larry, what do you want people to hear? What do you want them to think about? And he'll always say, how do we create a real partnership? So we created this acronym just for you, Larry, specifically. But a real partnership, these are really important things to think about, right? Like, number 1, I want you to think about recruitment. And I see the city of Peoria in here just asking a few questions. This might actually address it, especially if you're opening a new clinic, okay? There's a management book out there, if you've ever read it. It's called Good to Great. It's by Jim Collins. It's not about clinics, but from the concept perspective, one of the things they talk about in that book is first who, then what. It is so, so, so important to have the right people in the right seats on the bus, meaning that the success of your clinic, if you are opening a clinic, Alicia, this goes to you, is that it is the people inside that clinic. So don't just go, oh, we've got a warm body over here and a Band-Aid. If you have a provider who's not right for your population, that will tank that clinic immediately. In the same vein, if you have a bad egg, okay, inside one of your health centers, it's creating issues or just isn't well received by the population, you need to get rid of them. You just do. All right. It is better for you to wait for the right person than it is for you to just kind of put a Band-Aid on a bullet hole and keep on limping along. We see that all the time. I would say E, engagement from all stakeholders. Megan did definitely touch on that, meaning that anybody from safety to HR to leadership inside of the organization, so important to understand what the needs of this healthcare delivery mechanism need to be. Alignment and accountability of incentives. This is where I always say that this is where our vendor partners come into play. Megan talked a lot about, how do we redo the schedule? How do we have flexibility here? How do we increase staffing? I want to go through just 2 very brief scenarios with you. 1, many of you vendor partners are on the phone, right? You're like, well, we have longer appointment times and that's how we get everybody in. Well, yeah, I get that. But when you don't have same day, next day appointments and you have some acute care needs that need to take place, you can shorten those appointments to 15 minutes, and you just might have to, because the perception of people, especially who aren't purchasing healthcare in the US or aren't from here, might just be that they get a 15-minute appointment because they've got a weird rash that they need taken care of. And you need to make sure you're meeting those members where they're at. In the same vein, I'm sure you're a vendor partner on here who's like, we're at capacity, and you've got a municipal client who's like, we don't have the budget. It's like, how do we help you go ahead and make sure that you can open up access points, because you need to spend $200,000 on that NP. And lastly, leadership involvement, so important. And by that, I don't mean just signing a piece of paper or sending an email, but visible ongoing support, meaning that leadership is like the clinic is part of their overall strategy. It's part of a benefit that they're offering, and hopefully that they're using the clinic too. Always be careful what you wish for, though. Okay, that does happen, and it's usually, something might go wrong, but it's all good. Just joking. But the leadership involvement is so important too. So those are some things I want you to think about when you think about creating like a real partnership. Megan mentioned with that case study, it's your consultant partner, it is your vendor partner, and it is all stakeholders inside of your organization.
Yeah, and then I'll just add one other thing onto the recruitment piece of it. In the case study on the previous slide, you're not going to see that level of engagement in a first year if your members do not like the provider, right? I think that's a testament to showcasing how much value this provider brings. The comments, the feedback, when we had our annual review with this group, were through the roof positive about this provider in particular, to the point of, yeah, I want them to be my primary care provider, right? So, I just wanted to reiterate truly the importance of who is in your clinic, who is operating your clinic, who is interacting with your patients on a day-to-day basis. Because if it's not the right fit, you will not see that level of engagement that we just discussed in the previous slide.
Great. Well, thank you very much, Jen and Megan. It was very excellent and very informative. All right, now I'm going to go around the table. We'll take a couple of questions that have come into the chat box first. And if people have time, we will go a little past the hour so we can get everybody in. So let's start out with Alicia. She asked, they're looking for an equitable employee access through 18 departments and 1,500 employees with various locations, shifts, and roles. For those with similar locations or situations, what decisions were made or not made before your clinic's opening that had the greatest impact on the success of the opening, whether strategic communications or operations? So, Jen, Megan, you want to start out, and then anybody else on the call is welcome to comment as well.
Yeah, I definitely would say the recruitment piece is going to be a big deal. Make sure you've got the right provider before opening that clinic, even if it does delay the opening of the clinic. Sometimes that like, oh, we've got a temporary provider in here and people are really excited to use it. And then when those provider turns over, especially with a brand new clinic, that will create some discord at first. Secondarily, I would say when we talk about equitable impact throughout, it is making sure that those providers, especially in a municipality, aren't just sitting behind closed doors, okay? If you can get those providers out into those different departments for meet and greets, blood pressure screens, just saying hello, that makes a huge difference, because an on-site clinic is not an if you build it, they will come type of situation. It's like they've got to go out and be really proactive in how they're interacting with people in general. Megan, do you have anything to add to that?
Yeah, I'll just add in too, if you're, opening the clinic, to Jen's point of recruitment, are you understanding too and asking your vendor partner, how many openings in a specific position are they within a 50-mile radius of where we're opening this health center? I think that's extremely critical. So you have an idea from a recruitment perspective. How long can we anticipate this taking, right? So you may need to be flexible and adjust the opening of your clinic dependent upon that. If there's, 80 NPs, vacant positions open, well, you might need to also get strategic in how you're posting that job. Do we need to add on a sign-on bonus? Do we need to think, bump up the wage a bit? So that is a very important thing to think about upon recruiting providers and staffing for your clinic as you're getting it underway and launching it.
Yeah, and one thing I would add, as Megan had mentioned earlier, To me, the biggest reason why clinics fail is poor providers or those who don't match the culture or the communication. And there are a lot of docs and nurses who are only comfortable within the four walls of a clinic, and they're not comfortable going outside. They're not comfortable doing telehealth or virtual care. They're not comfortable going to the call center or going to the field to meet people. My number one recommendation is always interview the providers that your clinic vendor partner wants to bring in. Whether it's a doctor, nurse, medical assistant, receptionist. Receptionist is the front door of your clinic, and they will have a huge impact. And so as the employer, you should interview and approve anyone who goes through. Okay, let's go through some of the others. We have a question. What's the likely percentage of employees utilizing a clinic? So if your company has 1,000 employees, how many should you expect to show up?
So that's going to be 100% dependent upon what services you're offering. And I hate to say it depends because that's like the worst answer I can give you. But typically Megan mentioned it during the presentation, like year one, we see between like 25 to 30% engagement. Now, if you're offering occupational medicine and everybody's required to have a pre-placement physical, that number increases significantly. And so does your utilization in general. If you're managing workers' compensation inside of the health center, that also will have an impact on utilization trends that you can expect. If it's just advanced primary care, it really is also going to depend on your market, right? Are you a very saturated market for healthcare in general? And this comes from ThedaCare. You might be. So it's going to have to be, how do we move people from their current primary care provider over here so you get really that advanced primary care setting, and it's not just acute care in general.
Yeah, and in addition to that too, as I mentioned, if you're running your wellness program through your clinic and you're requiring, participants to get an annual physical, that also can help drive health center engagement and utilization right out of the gate, right? You're advertising it, it's readily available. They know that this is now the place I can go to get that completed. So, and then that elicits, a repeat user. So it's a good tool and good gateway to help drive that number up as well.
Great. Next question. What's the ideal clinic fill rate to ensure patients have options for various times of day and still maintain the same day, next day availability within your budget?
Clinic fill rate. Are we talking about like where's capacity? If it's capacity, we take a look at, I think like we're looking at like 85% capacity before you start to like change stuff a little bit. Sometimes we can push that up. And when we talk about capacity, it's not, just this one time we had a busy day or we're running biometrics through the onsite clinic so we have a busy couple of weeks. It's by trend. If we month after month without having anything like, let's say you all of a sudden you have, hearing exams running through the clinic, or you've got firefighter physicals running through the clinic or something like that, that increases or lessens the capacity of a provider, that's not an overtime thing. But if overtime, you're up over 85% on a regular cadence, that chart that Megan showed you that we do from a feasibility analysis will trend the right way to increase or justify another provider in some capacity.
Right.
Yeah, and I think too, it doesn't mean waiting until you're at that 85%, it's getting ahead of it, right? So once you start, tipping the scale and you're nearing that 70%, how are we looking at that in advance so that we're prepared financially, staffing wise? Because as we mentioned, it could take up to 9 months to recruit a new provider. So again, we want to get ahead of it before it's an issue and a problem that now we're just trying to put a Band-Aid on to solve in real time.
Yeah. Also, I'd like to add on to one suggestion on how to increase utilization that I don't think was mentioned, and that is make visit to the clinic part of your onboarding for new employees. Make sure that anybody who's getting newly trained, a new position, change over from some other place, either visits the clinic or has an information on it. It's often really helpful to incorporate that, and it's easy to get it on, and then all your new people already have that. All right, going down the list. Christy Patterson, comments or questions? Christy?
Sorry about that. The only thing I can really comment on is the importance of having, as you said, the right provider in the room. Without that, nothing else matters really. So,
okay.
Somebody committed to your population.
Thanks. Eddie Chen, any comments or questions, Eddie?
I would say the only question I have is if there's any sort of details that you can provide on communications channels. I notice you're still using physical print media. What about digital, and what results do you see from each?
I would definitely say most of the stuff that we can do that you just showed, like from a physical print perspective, is also digital. It's multiple different levers that are being pulled. Like for instance, like any of the stuff that you see that was in print can go on like, large TVs that might be in a manufacturing facility. We've done huge banners inside manufacturing facilities. The emails, depending on if, they can get out, that's great. Push notifications, depending on what kind of electronic medical record you're using, and if that's an okay thing, if the member signs off on it. So there's multiple different levers that you use, not just, hey, we're going to go ahead and put this in the benefits guide once a year,
Yeah. Yeah, and I think in addition to that too, I know it was on the screen, but your at-home mailers, right? Because if you're noticing a gap in engagement from your dependent population, odds are, it goes without saying. I mean, not to pick on the males in the room, but typically, right, the females are, if they're in charge of the healthcare, but it's the male who's had the onsite clinic at his employer, is he passing along that communication when he gets home? Maybe, maybe not. So let's get an at-home mailer out, and so that the spouses are aware of the services provided and can take the kiddos in, and so on and so forth. And then attached to that at-home mailer, maybe you have a magnet that, rather than just seeing that mailer, throwing it in the trash, let's take that magnet off, put it on our fridge. Here's the phone number for the health center. Here's the QR code. We can easily schedule, and now it's on our fridge when we need it at a moment's notice.
Yeah, another way is for those firms who have navigation or advocacy services that they use. Typically, those services will identify the lowest cost and the most accessible provider. Make sure that the worksite center is on top of that list, and that the navigation system, make sure that they promote the center as being easily available at low cost for those primary and chronic disease services. Elizabeth Chavez, comments, questions? Elizabeth? No? Okay, Gene Cook, any comments or questions? Gene? Take yourself off mute.
No comments or questions at this time. Thank you.
Okay. All right, let's again go back. Alicia Engel, Alicia, any other comments or questions?
No, thank you. The answers were very helpful.
All right. Deanna Hahn, any other comments or questions, Deanna?
No, thank you.
Okay. Tracy O'Neill, any comments or questions?
Well, I did comment in the messages when it comes to interviewing your providers, I would also recommend that you do a clinical interview. When I first started in this role as a medical director, I was new to this whole idea and concept. And, these providers are out there on their own, and they don't have somebody else necessarily to be thinking about things, differentials, that kind of stuff when it comes to treatment options. So they really need to be confident in their clinical skills. And I don't want to generalize, but somebody who's likely new grad is not the right fit for an employer clinic. You need somebody who's really had some experience out there. That was my first comment. The second thing is when you're talking to your employers, where are you getting your data from? Because I know that we could look at claims made. I know we have Epic, but getting things out of Epic is sometimes very difficult when it comes to trying to look at metrics and things like that to show value. And do you find that you compare maybe what your metrics are via your EHR and your claims made? Is that where you kind of try to figure out these performance guarantees and that kind of stuff?
So that's our data warehouse, Tracy. So I'll give you so Howden, we have a data warehouse, and we have one that's specific to the clinic consulting group. So we typically intake a file feed. Either the file is going to the health plan or the file is being kept by the vendor partner. Either way, we intake 100% of claims data, both both medical NRX as well as work comp or occupational medicine from a work comp carrier into our data warehouse. And then we request a file being sent, if it's not being sent up to the carrier, from the vendor partner. And that's where we're able to make these strategic recommendations and set performance guarantees based on vendor performance. It's third-party reporting that we have. If we have a clinic with an employer and you, for instance, like ThedaCare, if the employer is okay with it, we would certainly share that with you, and that helps the goal setting process a lot. And then we're able to measure it year over year.
Yeah, I'm unfortunately find too many employers do not direct their PBM and their health plan to send data to their clinic partner. I would think that as an employer, you always want to make sure that the clinic manager has that data on your claims from the PBM and plan. And if you're a vendor, make sure you request that from the employer. It just really handcuffs you and doesn't allow you to get a full picture. All right, with that, we're out of time here. Jenn, Megan, thank you again very much. Thank you for all around the call. And again, June 11th is our next program on occupational health. I hope you can all join us. Thank you all very much. Have a great
Thanks,
week.
Larry.
Bye bye.
Thank you.
Bye.
Bye-bye.